Good evening. I'm Psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling any place long distance, coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And let's start tonight's program with a question I recently received. Dear Dr. Fawver, will artificial intelligence ever have a place in psychiatry? Well, the whole concept of artificial intelligence in medicine is for you to program it so it can gather information for you, to give you some clues and give the operator, or the clinician for that matter, some better ideas more efficiently on what direction to go with treatment. So artificial intelligence in psychiatry, what I find is happening in psychiatry is we're gathering information in a different way. It used to be we'd sit down, talk to a patient for 2 hours, 3 hours, as long as it took. Back when I was in training, we would have 3-hour interviews. Well, that's obviously not really time efficient for the patient or the clinician. So what we're doing now is we're gathering more information with questionnaires. So as we can gather more information with questionnaires, it's more patient-generated note-taking as opposed to artificial intelligence. There is a means by which, even currently in electronic medical record systems, where you can simply put a microphone or a cell phone in front of the patient and between the patient and the clinician, and the data will be received in the cell phone, the smartphone, and that will go directly into the note itself, and that's considered to be artificial intelligence. But I think artificial intelligence is for the purpose, mainly right now in medicine, to be able to gather lots of different symptoms, lots of different information, and try to compartmentalize that information to make better decisions. In psychiatry, the way I see it occurring will be that it will help us give us better algorithms on what direction we should go. For instance, would somebody be a better candidate for this class of medication or this class of medication based not only on their symptoms, that's called phenotype, but based on their past history of treatment, based on their genetics perhaps. Maybe someday we'll be able to do some brain imaging and determine who's going to be a better candidate for this or that medication, based on their medical comorbidities, where they have other medical conditions. We're trying to do a lot of that right now with questionnaires and gathering information and grouping it all together. But I think in the future we'll have artificial information helping us in a good way. You always have to remember, though, with artificial intelligence, somebody has to program that information to determine what direction the computer takes you in those cases. Thanks for your email. Let's go to our first caller. Hello, Sophia. Welcome to Matters of the Mind. Well, let's go to our next email question. Our next email question reads, Dear Dr. Fawver, my genetics show that I have a catecholmethyltransferase mutation, COMT mutation, also known as a COMT mutation. What's it mean, and can I do anything natural to deal with it? A COMT mutation means that you have either slow metabolism for breaking down norepinephrine or dopamine. That would be a COMT MET-MET. Or you have a COMT VAL-VAL, which means you have fast metabolism of norepinephrine and dopamine, particularly in the front part of the brain. Now, a slow metabolism of dopamine and norepinephrine, a COMT MET-MET, occurs in 1/4 of all of us. So 1/4 of all of us have that slow metabolism of norepinephrine and dopamine in the front part of the brain. What's that mean? It means that you might notice that you're a little bit more irritable, a little bit more snappy in some situations. You can certainly be more sensitive to pain, and we have to take that into account when we treat people for pain, because they might have more pain sensitivity if they have COMT MET-MET. Naturally, if you have COMT MET-MET, you could take magnesium, 200 milligrams twice a day, 600 milligrams twice a day if it doesn't give you diarrhea. But magnesium supplements, particularly magnesium citrate, which is highly absorbable, can be helpful for a COMT MET-MET so-called mutation, but mutation sometimes makes people think it's a rare type of phenomenon, but COMT met, about 1/4 of us have that. On the other end of the spectrum, COMT val, that's where you have a fast or high metabolism of dopamine and norepinephrine. You're going to be a good candidate if you have depression or ADHD for a more of a dopaminergic mechanism of action. For instance, with depression, people can take bupropion, they can take vortioxetine, also known as Trintellix. If you have ADHD, you could have maybe better luck with a stimulant medication as opposed to a non-stimulant. So about 1 out of 4 people have a COMT val genetic type. So 1/4 of all people have a genotype of COMT met. 1/4 have COMT val. Then you have the people kind of in the middle. 50% of people have COMT val/met, and that's considered to be normal. But if you hear somebody say that you have a COMT compt mutation, it either means you have high metabolism or low metabolism. And as clinicians, we have to take that into consideration. People on bupropion or Trintellix, for that matter, don't do so well at higher doses when they have COMT met. They tend to need lower doses of the medication. People who have COMT met often don't do so well with a stimulant. So we have to use lower doses of that or maybe give them a non-stimulant option. Thanks for your email. Let's go to our next caller. Hello, Sophia. Welcome to Matters of the Mind. Sophia, you wondered, can CBD gummy or CBD oil interfere with your Zoloft? Possibly. It's been studied somewhat, Sophia, but possibly CBD can inhibit the metabolism of sertraline or Zoloft. That means you're going to have higher blood levels of sertraline or Zoloft. What's that going to do to you? It's going to give you a fast heart rate, headache, diarrhea, sweatiness. It's going to give you serotonin toxicity or serotonin effects because instead of, for instance, taking 50 milligrams of Zoloft, your body's going to feel like it's getting 200 or 250 milligrams of Zoloft. So if you use CBD with a medication like Zoloft, or for that matter, any antidepressant medication, just make sure to tell your clinician because we can adjust the dosage accordingly, but in my practice, I just prefer people not use CBD. If they're having trouble sleeping or with anxiety, I've got other options for them outside of CBD, but my biggest issue with CBD will simply be that when used with other medication, it can give a lot of interactions and cause you side effects from the other medications. So we try to stay away from that. Thanks for your call, Sophia. Let's go to our next caller. Hello, Fred. Welcome to Matters of the Mind. Fred, do you want to know, does alcohol have a negative effect on ADHD? Alcohol will affect a particular receptor in the brain called GABA, and it kind of slows down the brain. GABA is the brakes on the brain. With ADHD, you think, well, yeah, that'd be good, right? You want brakes on the brain with ADHD. Well, if you put the brakes on the brain with ADHD, it can inadvertently cause your brain to slow its processing. You don't want that with ADHD. When people have ADHD, they have trouble with this left front part of the brain where it's just not focusing well enough. It's underactive and you're bouncing all over the place with your thoughts. You can't maintain attention and you're easily distractible. You want to be more focused and less distractible. Now, why would people drink alcohol with ADHD? Many people will drink alcohol with ADHD if they have a lot of social anxiety, which is a common comorbidity of ADHD, because when you have ADHD, you have a hard time following conversations. You go into a room with a lot of people and you hear all the different conversations. It's like having a lot of extra sound in your brain and you're hearing it all. So what do you do in a social situation in those cases? Well, many people will go right to the bar, have a few drinks, and calm themselves down because ADHD will often be associated with a lot of anxiety. So alcohol can briefly alleviate anxiety, but it won't alleviate the underlying distractibility and inattentiveness that you might have with ADHD. So if you have social anxiety, well, we're also often going to want to look at the underlying causes of the social anxiety itself, and not uncommonly, ADHD can be a reason for that because of the reasons I cited. So we want to treat the underlying ADHD symptoms, knowing that alcohol can kind of slow down the brain processing a little bit by itself and give you difficulty with thinking. Yeah, alcohol has been used for centuries as a means of decreasing anxiety for people, but it's just not a good means of trying to relieve the anxiety associated with ADHD. Thanks for your call. Let's go to our next caller. Hello, David. Welcome to Matters of the Mind. David, you want to know, why do you want to be dead all the time? I'm not sure where you're going with that question, David, but for one thing, if people have this existential sense that they don't want to be around. They just wonder about their purpose and meaning in life. Yeah, from a psychiatric standpoint, it can be a sign of clinical depression. It's one of the classic signs of clinical depression where somebody just does not want to be alive. They ruminate about dying. They obsess about it. They are thinking about that. And it's a means of escaping from life as it is. So many people with those kind of symptoms will actually look forward to the time that they might die because their life circumstances may not be as they would choose. What I'd recommend, David, is several different things. Number one, keep a diary. Keep a diary of your day-to-day activities. You can just write down week by week if you wish to do so, and write down what kind of things you're going through and what kind of things are going well for you, what kind of things are not going so well for you. You'll notice, David, that over the course of several months, the things that are not going so well for you really turned out okay. And I point that out because many people, when they're thinking about dying and they just can't go on any longer, they feel overwhelmed with their current life circumstances, and they're having difficulty coping with their current life circumstances. So if they keep a diary and come to an understanding that several months down the line, they look back and they realize things worked out, that can be very reassuring to know that, okay, you're going through a tough time of your life now. Know that you've gone through some tough times, and now you have other tough times coming up. You know that you'll be able to get through those as well, one way or another. Secondly, what I'd recommend, David, is try to have some kind of meaning and purpose in your life, whether it be family, whether it be your faith, whether it be your work, some kind of goals. Have something in which you can look forward to and have some meanings for life. Many people with chronic depression will struggle with just lacking any purpose and meaning in life, and those people will often think about death, and some people will actually try to take their lives. Many people who will attempt to take their lives and they survive perhaps a suicide attempt will say the reason they tried to take their life was because they just didn't see any meaning and purpose anymore, and they had a sense of hopelessness. Hopelessness is a key trigger for many people where they just can't see any hope for their current life circumstances. That's why I'd recommend the diary to try to get you an understanding that things that don't seem like they're going to work out now can work out in the future. Thanks for your call. Let's go to our next caller. Hello, Jack. Welcome to Matters of the Mind. Jack, you want to know about the benefits of guanfacine and its many uses. Guanfacine is a medication. It's an old antihypertensive medication. It's called an alpha-2 agonist. It stimulates alpha-2 receptors. Alpha-2 receptors are a type of norepinephrine receptor. And basically, if you stimulate alpha-2 receptors, you can have improvement with focus, concentration, and decreased distractibility. So on one hand, guanfacine is used with ADHD type medications. Intuniv is a medication. It's a long-acting guanfacine. And Intuniv is a medication that can be used in addition to stimulant medications or other ADHD medications. So that's one use of guanfacine. Another use of guanfacine will be for flashbacks, nightmares, and people who have post-traumatic stress symptoms. People with PTSD symptoms will often take a medication like guanfacine as a means of settling down jumpiness and irritability like that. Occasionally, guanfacine will be used for anxiety and irritability itself, but more commonly, it's used with ADHD and it's used for post-traumatic stress disorder. Thanks for your call. Let's go to our next caller. Hello, Margot. Welcome to Matters of the Mind. Margot, you want to know about the social challenges people might face with high intelligence traits. Social challenges with people with high intelligence or high IQs can go along with ADHD or autistic spectrum conditions. People with ADHD often do have high IQs, and when you have a high IQ, sometimes that can be attributed to other conditions. It's not the high IQ that gets you into trouble socially. It's the kind of conditions that might go along with high IQ. For instance, with ADHD, it's thought that people have higher IQs by nature of having ADHD. But when you have attention deficit hyperactivity disorder, you can have trouble with attention span, distractibility, and focus, but you can also have trouble socializing because you're always thinking 3 steps ahead of the conversation with others, and you might want to finish the sentences of others. You're thinking about other things because you're distractible, so you're not really engaged in the conversation itself, so then you might come across as being forgetful or somebody who lacks tact or somebody who's just uncaring because you haven't really heard the conversation when somebody might have asked you for a particular request. So ADHD can have the comorbid social disturbances that indirectly can be related to the high IQ that people can have with ADHD. Many other people will have a high IQ with autism spectrum condition. Basically, when people have autism spectrum conditions, their right front part of their brain is a bit underactive, and in being a bit underactive, they will have difficulty connecting socially with other people because the right front part of the brain is where the mirror neurons are. We naturally, whether you realize it or not, in social environments will mirror the behaviors and mannerisms very subtly of other people. It's a natural way for us to connect with them, so we might use some of the same facial mannerisms, same body language, maybe even the same voice inflection as a means of connecting with other people. We often don't even realize we're doing it, but that's what we do. People with autism will have a hard time doing that. People with autism will have difficulty being able to sort out if other people are interested in their conversation. They have a hard time shutting down their conversation and having a back and forth exchange. People with autism will often have what's called pedantic speech, where they talk and talk and talk and talk without really getting the back and forth in the social engagement. So for that reason, many people with autism will have trouble with interpersonal relationships. You can coach them through it, and basically people with autism need to be put in social environments where it can be adaptive for them to be able to pay attention to things that other people might not notice. I've often mentioned that in the Israeli Defense Forces, they have a autistic task force in their intelligence organization of over 150 people now from what I last heard. And basically these people with high spectrum or autistic spectrum disorder, or if you want to call it a disorder itself, these people have autistic features, and they're able to identify things in the face of the intelligence that other people can't notice. So you can often put these people in situations where they can thrive as opposed to considering a disorder. Autism is something that maybe can be treated in various ways. Where we get in trouble when in treating people with autism will be when we try to over-treat them for some of these nuances that they might have, some of these idiosyncrasies they might exhibit. If somebody's having difficulty where they truly need psychiatric treatment with autism, it's where they have explosive rage or they have tremendous difficulties putting up with changes. In the brain, there's a central operating system called the thalamus, right smack in the middle there. And the thalamus, it's taking in outside information. People with autism, and we'll see this with people with schizophrenia as well, don't network that information properly. In other words, it's like an operator who's just randomly sending out signals. That people with autism and people with schizophrenia just can't be able to network the information that's coming in from a sensory standpoint. So they become overwhelmed with lights, sounds, lots of different people talking, lots of changes occurring at one time. So in those cases, we try to treat them sometimes with medication, sometimes with coaching techniques to try to help them adapt to change. But it's that coping that people can often have difficulty in struggling with autistic spectrum conditions. Thanks for your call. Let's go to our next caller. Hello, Chris. Welcome to Matters of the Mind. Chris, you want to know why you're constantly in a sense of fight or flight. Is that anxiety? Fight or flight ongoing, Chris? I'm going to wonder a lot of different things there. Do you have a cardiac condition where you have a cardiac arrhythmia that's causing you palpitations? Do you have high thyroid? High thyroid will make you feel really anxious all the time. Do you have maybe a condition even like sleep apnea? Sleep apnea, especially in the morning, will make people feel really anxious. So I'd want to know more about the medical history and what might be causing you to have ongoing fight or flight. When did it start? Did it start at a particular time in your life? Did it start in social situations? Did it start when a medication change occurred? So there's a lot of reasons why people can have this sense of ongoing fight or flight. Now, usually when people have a fight or flight type of feeling from a psychiatric standpoint, okay, it can be from a panic disorder. Panic disorder can often be precipitated by a particular social situation, and you get in that kind of social situation, you feel like you got to leave really quickly or you're going to panic. So that's the fight or flight type of phenomenon. But having an ongoing makes me think it could be some kind of medical issue that potentially could be treated. But talk to your primary care clinician about that particular condition. Thanks for your call. Let's go to our next caller. Hello, Dixie. Welcome to Matters of the Mind. Dixie, you'd mentioned that in the 1960s you were pregnant and you're having issues with sleeping and you're prescribed sleeping pills back then. You were in the hospital where they used ether Could that have affected your son's current mental state? Maybe. I know back in the 1960s, a lot of things like that were used. And it's difficult to say, Dixie. I don't think definitively ether was found to cause any brain disturbances with newborns, because so many of us who were born back in the 50s and 60s did have mothers who had general anesthesia in various manners. So I think it comes down to any evidence of what's called brain anoxia for the newborn baby. So if a newborn baby did not get adequate oxygen to his or her brain, sure, that could have been a problem. Many people got sedative hypnotics, benzodiazepines back in those days that we wouldn't give today. I think a lot of it has to do with the dose relationship effect. If you got a really high dosage of ether, of the sedative hypnotics for sleep, that could potentially have caused developmental disturbances early on, but it's difficult to say going back that many decades at this point. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, I'm having trouble concentrating throughout the day. What might be causing that? Well, trouble concentrating throughout the day can be a factor where you've had it all your life, where every day you've had trouble concentrating, or you've had trouble concentrating for the past, 3 years, 4 years. So it all comes down to when it started. So if it started in childhood, you're having trouble concentrating day by day by day, you don't know, is that more than what you'd expect from anybody else? And that's the whole concept of attention deficit disorder, or ADHD, with the hyperactivity that we've been talking about some tonight. So the attention deficit disorder, that will give you difficulty maintaining focus and perseverance on interest and uninteresting type of subjects, and subjects that aren't new and exciting. In other words, you might get started on something and then you go to something else. That's ADHD. So depression, if it's come on more recently, in recent years, people who have depression will often have trouble with what's called speed of processing, where they can't process information very quickly. It's like their brain has slow internet speed. So it's a kind of phenomenon where depression, clinical depression, will cause your brain to kind of slow down in its ability to process information quickly. Many people have medical conditions such as low thyroid. High thyroid will do it too. They'll have diabetes, they'll have low iron, sleep apnea. I mentioned that before. Sleep apnea is where you might snore, you pause in your breathing at night, you're not getting adequate oxygen to the brain at nighttime. That will give you tremendous difficulties with concentrating the next day. Many women in their late 40s, early 50s will be going through some menopausal hormonal changes. Now, the brain has all these little estrogen receptors right here in the hippocampus, and that's the memory center of the brain. So when you're going through menopause, not uncommonly, people will say they have trouble with memory, but some people will say it actually affects their ability to focus and concentrate. So that can be an issue as well. People will have difficulty concentrating if they've had a frontal head injury. In other words, they've had a concussion that affected the front part of the brain, because the distractibility can be due to an underactivity or at least a slightly damaged area, the front part of the brain. So when that occurs, there are certain ways that we might treat that. Well, let's say you're in your 80s or 90s and you're all of a sudden having trouble concentrating. I'd want to look at all those aforementioned medical issues that I mentioned, but okay, do you have dementia? We always want to sort out all the other kind of medical issues themselves, but dementia might be a possibility as we get older. We're all more likely to have dementia. Some of it's genetic, can be worsened and give you more of a likelihood if you have high blood pressure and diabetes. So dementia has a lot of risk factors that go along with it, but getting older is the biggest risk factor for dementia. So if you're having trouble concentrating, think about when it started. Could it be related to a medication you've recently been taking? Talk it over with your primary care clinician to kind of see what kind of options might be available for you. Let's go to our next caller. Hello, Kate. Welcome to Mayor's the Mind. Kate, you mentioned that you've been practicing mindfulness for several years and noticed that your anxiety has increased over time. Is that a side effect of mindfulness? Actually, mindfulness type of meditation, Kate, is technique that people will actually use to decrease their anxiety. If your anxiety is increasing, talk it over with your primary care clinician to see what kind of options might be available for you. But if you're doing mindfulness properly, that's actually a technique for decreasing your anxiety. There's other techniques you can use that are natural to decrease anxiety. What's your caffeine intake? Some people will notice that if they cut their caffeinated coffee intake by half, that makes a big difference in their anxiety. But also breathing techniques, especially exhaling, spending some time inhaling, but using twice as much time exhaling actually fires up this particular autonomic nervous system called the parasympathetic autonomic nervous system. That will actually slow down your heart rate and can decrease anxiety itself. So there's a lot of other techniques outside of mindfulness that might be helpful for you as well. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you may write me via the internet at mattersofthemind@wfwa.org. God willing and PBS willing, I'll be back again next week. You've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.